Right, let's kick off then. Hi everyone, my name is Tal, one of the doctors at First Care Practice House, and thank you for joining our series of COVID-19 webinars where we discuss things that might be of interest to you. And the idea is to entertain and inform and keep you updated about the stuff that is going on at the practice. So today we would like to share what a life of a physician associate is. So some of you may not be familiar with that role. So we're really fortunate in our practice to have two. And I have to say they've been working with us for just over a year. And initially they were students actually, and they've been absolutely amazing. So allow me to introduce to you Rowena. Would you like to say hi?
Hi everyone, I'm Rowena, one of the physician associates at First Care Practice.
And Shabnam.
Hi everybody, I'm Shabnam, one of the physician associates working at First Care Practice.
Excellent, thank you guys. And let's start with a little poll to just ask people if they are aware as to what a physician associate is. Okay, if you could vote. Thank you. So, yeah, that shows not many people are aware of what a physician associate is. So let's kick off with Shabnam then. Shabnam, what is a physician associate and what do you do?
So a physician associate is another new healthcare professional who is trained to diagnose, manage and deliver holistic medical care. So we work alongside doctors, nurses and other medical professionals to deliver better care to patients. So we're trained to be generalists and we're quite flexible, so we can work across different specialities and fields.
Excellent. And so, Rowena, what made you become a physician associate?
So when I finished my undergraduate degree, which was in biomedical science, I worked as a laboratory assistant for a couple of years. I definitely knew that this was not my career path. And I actually heard about the role of a physician associate from a colleague of mine. And I was really interested because I would love, at that time, I loved the idea of patient care, engaging with patients. So I thought, why not? And now here I am.
Excellent. And we're very grateful to have you. I just want to share with everybody a little video which outlines what physician associates do. So bear with me 1 second. I'll get that up and running. Okay. My name is Tal and I'm a senior GP at First Care Practice. My experience with physician associates on a daily basis has been a really positive one, both in delivering of clinical care, reducing demand on the clinicians and actually helping with the administrative side of things for the practice as well. I think the impact of the physician associates has been remarkable. It's changed the way that the practice works and runs. You think back to just 3 months ago, 2 or 3 months ago, when we didn't have any PAs, and now it's a much different practice. It just feels as though we're a more cohesive group of people delivering better care. So that was a video that you guys did for Health Education England, which, and actually I'm pleased to share that not only are you working here, but you're also working as ambassadors as physician associates for Health Education England. So congratulations on that role. Can I just ask what that role involves? Shabnam?
Yeah, so we're working as part of North West London, NHS England. So our main role is to sort of increase the recognition of PAs, both in primary care, so in GPs, and in secondary care as well, so hospitals and specialist clinics. We work alongside universities to help with placements and with education, and also with doctors and stakeholders to sort of increase their recognition and their role, improve their role in the workforce.
Thanks. And how you've only been there in post for a few weeks, I think, isn't it, Rowena? How have you found it so far?
I mean, so far, because we have just been assigned the role really, really recently. So me and Shabnam have both attended a meeting in Ealing where we talked to a number of different healthcare professionals, just explaining exactly what physician associates are. And I think there needs to be an increased need for physician associates. That's all we've done so far in the role. Things have come to a stop at the moment due to the coronavirus issue, but hopefully when that's all done and under the carpet, we can continue our role and making sure that we raise recognition of the PA role.
I think that's an admirable job, so good luck in that. And I think it's interesting how people's opinions, certainly in that meeting in Ealing, changed from being kind of sceptical to being kind of advocates, and so well done. Shabnam, some people might be interested in becoming PAs. Can you just outline the journey that they need to take, or how does the qualification process work? What training do you need to do if you're interested in becoming a PA?
Sure. So the Physician Associate course is a postgraduate course. It's a very intensive 2-year course. So prior to that, you would need some sort of either medical or science background. So for example, both myself and Rowena have a background in biomedical sciences, but there are lots of PAs that have come from pharmacy, physiotherapy, nursing backgrounds, or even veterinary. So it could be anything to do with science. And then in total, it would be a minimum of 5 years of training. So the first year of physician associate studies would entail very intensive theory, full-time course, and then the second year would be rotation of a series of placements where you would go and work in the practical field and learn on the job.
That sounds pretty intense. So have you found it rewarding?
Definitely. I think it is very, very difficult. It requires a lot of, it takes up a lot of time, but at the end of it, when you see how you can contribute to improving patient care and helping the NHS as a whole, it's very rewarding.
Thank you. And Rowena, just can you explain, where do physician associates work? So we know you guys work in general practice, but where else can they end up working?
So physician associates are quite lucky because, yep, you can find physician associates in GP practices, but you can find a lot of physician associates in hospitals as well, where they work in all different sort of specialties. So you can find them in A&E, in more specialized departments like cardiology or respiratory. They work across such a wide range of different specialties. So we can work in primary and secondary care.
Excellent. And generally, do they end up working in primary, or do they generally end up working in secondary care? In hospitals, Rowena?
So, to be honest, I think at the moment, most physician associates who qualify do tend to work more in secondary care, so more in hospitals. But this is the reason why me and Shabnam need to work with other physician associate ambassadors to raise the awareness that physician associates can work in general practice, and it can be really rewarding and it can work really well.
Thank you. And Shabnam, so today's little webinar is about sharing a day in the life of a physician associate. So obviously at the moment it's all very different because of the coronavirus outbreak, but do you want to share some sort of, give people an idea of the sort of stuff you're doing at the moment? So normally you would run clinics and you would see patients and in your normal clinical duties, but how would you describe your life at the moment and the way you're working at the moment?
Thank you. So yeah, at the moment, because of this coronavirus, things have changed quite quickly, and just like with a lot of other healthcare professions, we've had to change our roles very quickly as well. So at the moment, we are doing a lot of telephone triage, so dealing with calls and queries over the phone. We have doctors available if we need to discuss any complicated patients or have any queries about the patients. Alongside this, we are trying to hold, so like this webinar, we're doing a series of webinars on more common conditions or things that we can help our patients with. And we're also running group sessions where we, for example, patients with diabetes or asthma or COPD, we're bringing them in on virtually in little groups where we can discuss things as a group, sort of share our tips and ideas and management plans as well. But behind the scenes, we're still managing blood results and clinic letters and trying to just make sure everything in terms of the patient, making sure that their care is being delivered as normal and trying to keep our practice running as normal as well.
Thank you. And Rowena, can I just ask, so you're working in the space of a few weeks, you're working very differently. How are you holding up with all of this change?
To be honest, it's a very strange time at the moment because obviously as a clinician, you're used to going into your workplace and seeing your patients face to face. But now, I mean, we've had to do a lot of stuff over the telephone, can't see patients face to face. It is really difficult, and we have had to adapt to this. It's tough, but I mean, we are getting through it, we're getting used to it, and we're finding different ways of getting in touch with our patients through doing these range of webinars. It's another way of providing patient care.
No, thank you. I think you're both doing an amazing job, and that I have to say that we do regular surveys of feedback from patients, and certainly the PAs have done at least as well, if not better, than any other group of clinicians. So the patients themselves are recognising the support that you're kind of giving them. Shabnam, just a question for you, sort of just to finish off a little bit. How do you think this coronavirus crisis is going to change the role of PAs in the future? What do you think will happen after the coronavirus is over, and the way that you work?
I think this period of uncertainty has sort of given PAs a different way to work. So normally we wouldn't be doing a lot of virtual work like webinars or telephone triage, and I think it will show both PAs and doctors, employers, supervisors that we are able to be quite flexible, and if there are any things that we need to change quite quickly, we could. And to be honest, I think the future of healthcare and medicine is changing quite quickly, and there will be a lot of new technology being put in place, and all these things will help greatly in improving and increasing the recognition of PAs as well.
Thank you. And we'll just finish off with some quick little messages, perhaps to different groups of people. So, Rowena, would you like to give a little message to people who are thinking of becoming PAs themselves?
A message to everyone who is thinking of becoming a physician associate: just do it. You won't look back. It's such a rewarding job role. You will absolutely love it, and you'll meet amazing colleagues and patients. You will love it.
Thank you. And Shabnam, a little message for patients who are going to see PAs, but they're not really sure who they are and stuff.
Yeah. So totally can understand that when you're seeing a new healthcare professional, you might be a little bit skeptical, but please, just let us just see you and just see how we can deal with your queries and how we carry out consultations, and hopefully you'll be more than happy to see us again.
And that's been the experience at the practice, actually. So the initial, there was a bit of skepticism, but now they definitely prefer to see PAs rather than doctors. So, and Rowena, last little message for you for other practices who are thinking about having a different sort of workforce. Perhaps you'd want to sort of share the role that PAs could play within general practice.
So to other practices who are thinking about another role that they could have in a GP practice, PAs, I think they can definitely help the team. We can, share the workload, take off all the patients that have minor issues, give you more time to concentrate on the more major patients with major issues. Yes, we're here to help you.
Thank you very much, and thank you so much, guys, both of you. So it's goodbye from Shabnam. Thank you.
Good. Thank you, everybody.
And it's goodbye from Rowena, although I think she's kind of frozen. Oh no, she's back. Thank you, Rowena. Bye for now. Say bye. Otherwise, you won't go.
Bye, thank you.
Bye.
Bye.